I'll scan the room real quick.
Alright, well, my name's Thomas. I'm going to be doing immediate care of the newborn. Before I get started, I'm going to do my 12 safety practices, and those are, I'm going to verify my doctor's order. I'm going to check my facility's policies and procedures for that, gather all of my supplies and look at any manufacturer's guides if I need to for those supplies. I will come to the room, knock on the door, identify my patient with 2 identifiers and let them know who I am, what I'll be doing that day. I will provide for privacy and note their overall appearance, raise the bed for good body mechanics, and don a PPE if necessary. Once I've completed my task, I will return their bed back to its lowest level, side rails up, call light within reach. And I will document any abnormal findings to the charge nurse. Okay, so now that that's out of the way, our baby has been delivered. He is freshly out. He is naked here. I have my heat lamp cut on. That's already been prepared, and my APGAR timer has started now that he is laying on the table. So the first thing I want to start off with my baby is I just want to go ahead and make sure their airway is clear. So I'm going to turn the baby and facilitate some of that drainage. And I'm going to start with the mouth, nose, and I'm discarding over here, and then nose. Okay, so our airway is clear. And then my next step will be preventing cold stress. So I want to make sure the baby's nice and warm. So we're going to start by drying our baby off. You want to get into the crevices and make sure that there's no excessive liquids or anything on the baby. At this time, you want to also clean off the baby's backside, and when you do that, you want to assess that there's no abnormalities or deformities with the spine, backside, anything. You don't want to just clean blindlessly. Okay, so our baby is nice and dried off now. I'm going to go ahead and cover him up, so that way, he's not getting cold. Don't want to smother our little baby here, so. Okay, so our baby is covered now. He's nice and warm. So at this time, my APGAR timer has gone off, so I'm just going to go ahead and observe the baby, keeping him covered up here so he doesn't get too cold. His reflexes are looking pretty good. He's moving those arms and those legs. He's not just sitting there flaccid. When I look at his chest, I'm seeing it rise and fall evenly on both sides. I can check his brachial pulses. They seem to be even, nice and strong, at a good rate. I'm gonna check his little feet, rubbing the bottoms and making sure that those toes are moving and responding accordingly on both sides, which they are. Our baby appears to be nice and red and warm, so they're getting good perfusion. So his APGAR score is pretty well. While I have him here, I'm going to go ahead and attach his name bands. He'll get 2 and the mother will get 1 for identification. So he has his name band on. He's still nice and covered up. I'm going to go ahead and get his footprints. You want to go from bottom to top. Smacking on the paper. And then the same with the other side, bottom to top, and put it on that paper. Okay, so our footprints are now taken for documentation. Our baby's covered, clean, APGAR is good. Before I hand him off to his mother, I want to go ahead and give him any medications that have been ordered. So starting off, I have some eye prophylaxis, and we're just going to put that in his lower conjunctival sac. Make sure we don't touch the eyeball from inner to outer, and we're going to do that in the same on the other side. Okay, so he's received his eye ointment. We have a written consent form for vitamin K, and that goes in the vastus lateralis. And I don't know if I noted this, but I'm gonna also observe the umbilical while I do the APGAR and just make sure that there's 2 arteries and 1 vein, no sort of smelly drainage or anything like that. His appears to be fine. I'm gonna uncover that vastus lateralis, kind of pinch it, clean it off with the alcohol, 90 degrees straight in. So he's now received his vitamin K. Our baby here also has an order for a Hep B, so we're going to give him a Hep B shot as well. We're going to do that on the other side in the vastus lateralis. Pinch it, clean it with alcohol, 90 degrees straight in. Okay, so our baby has now been cleaned, dried, APGAR looks good, umbilical cord looks good, he's received all of his meds, so now we can deliver our baby to the mother. And once I've done that, delivered it to the mother, I'm going to do my patient teaching with her, and I will be teaching her about bottle feeding. With the bottle feeding, I'm going to kind of assess her knowledge beforehand. I'm going to tell her the steps verbally. I will demonstrate it for her, ask her if she has any questions about that, and then I will have her demonstrate and teach that back to me. So you always want to treat the formula as if it's medication. So there will be a specific order for it, a specific ratio of formula to water. So you want to make sure you have that correct before you go administering it to the baby. I would go ahead and check the temperature on the back side of your hand or something, make sure it's not too hot, too cold. You're going to take our little baby here. You're going to support his head, keeping the head above the stomach. Take our bottle. It's good temperature, properly mixed. Let the milk fill into the nipple. Make sure there's no air to prevent gas. You're going to put it on the top of the baby's tongue and let them take that. You want to just assess how they're taking that nipple and making sure they have good suction and you're not hearing any smacking sounds or anything like that. The baby's taking it well. About every milliliter or so, you want to just stop the feeding, set your baby up, and just burp them. You're going to do that a couple times throughout the feeding. They won't be able to take it all in one sitting, and then just return back to normal. You never want to leave that bottle propped up and leave the room or anything, because the baby could aspirate. If the baby seems to be getting uninterested with the feeding, you can discontinue. No need to force feed them. We'll burp them one more time. And our baby is burped, had his food, so we'll just leave him sitting up, holding him, whatever he prefers, for at least 30 minutes to just prevent anything from coming up and him possibly aspirating. And that's it.